Hey guys, what's going on? Derek here with PopWrapped, and today we're talking plastic surgery with Dr. Babak Dadvand, double board certified plastic surgeon here in Beverly Hills. Let's go see what he's got going on. Hey guys, what's going on? Derek here with PopWrapped alongside Dr. Babak Dadvand.
Hi,
Did I say that right?
Yes, you did.
Yes,
you did.
Double board certified surgeon in Beverly Hills, and we're here to talk about all things doctor, as well as his one of his specialties, gynecomastia.
That's right. That's right.
Tell us, how did you get involved in surgery, and what was kind of the inspiration for you to actually take on something like plastic surgery?
So that's a great question. I come from a family of doctors, and I knew from a pretty young age I wanted to go into the family business of being a doctor, and so I went into college and I actually majored in fine arts because I also had a real interest in that. And going through medical school, I knew I wanted to be a surgeon, and so I got into a pretty good general surgery program, and during that residency training is where I got to experience firsthand plastic surgery, and it was really an amazing experience because it opened my eyes up to how you can creatively think about different problems and get to a good solution. And it wasn't so much just based on a mechanical operation of just doing the same thing over and over again, so it really spoke to my kind of artistic side. And it was a nice marriage of the artistic aspect of my fine arts training as well as the technical aspect of my surgical training.
So let's get into it and tell us about gynecomastia. What is it? What are the symptoms? What causes it?
Yeah, so gynecomastia, just quite simply, if you break it down into the root words, it's Greek, and gyne basically means female, and mastia means breast. So it's a man or a guy who basically has a feminine breast. And so there are a lot of different causes for gynecomastia. Anything from medications, there's a genetic component, obviously things like steroids or certain workout supplements. And then there are also other medical conditions like endocrine issues or thyroid conditions that can cause it. And aside from those known causes, there's this category called idiopathic, and what that means is we don't know the cause. And in a large number of guys, maybe 50%, we don't really know the cause, but it happens sometimes during puberty, and in a certain percentage it doesn't go away. And then those are the guys that come up seeing me in my office.
What constitutes maybe a difficult surgery versus maybe an easier procedure? Like you mentioned, like the skin tone quality or people's age. What creates like the ideal patient, and what presents more challenges for you as a professional?
Yeah, so that's a great question as well. I think there's no easy surgery. Every surgery has a potential of having complications, and I think it's knowing what those potential issues can be beforehand and not realizing it after the fact or in the operating room. And so I take a lot of time to surgically plan every case. I not only from the examination that I do, but reviewing the photos that I've taken before surgery, and I come in with a plan, but also with the ability to think on the fly as well. If I encounter something in the operating room that I wasn't expecting, that I'm prepared for it. I think one of the things that in talking to patients is really important before we go to the operating room is to figure out what their expectations are, right? And I'll give you an example. A guy who comes in who's got gynecomastia, doesn't really work out, but and is a bit out of shape, but really wants to come out of the surgery itself with a super chiseled look, I tell them straight out, like, look, I can get you to this result, and then you need to also to work on your body and eat right and exercise, and you'll get that shape that you want, And I think it's being on the same page with the patients and knowing what their expectations are and being able to assess whether they're realistic and then achieving those goals. There are two things. There's true gynecomastia, and then there's a term called pseudogynecomastia. So true gynecomastia means increased breast tissue. So every guy's got breast tissue and fatty tissue in their chest. And so if you've got too much breast tissue, that's true gynecomastia. That can't be fixed with diet or exercise. There's no magic medication or pill that you can take that can successfully and predictably treat that in every patient. Now the other term, pseudogynecomastia, that is someone who has just excess fatty tissue, but their breast tissue amount is normal. And so that technically can be potentially fixed with just exercising, dieting, losing weight, and getting into overall better shape, because just like you would lose fat anywhere else in your body, you could lose fat in your chest as well. it can also be treated surgically as well with liposuction. So it just depends on what the patient's motivation is.
Oh.
Guys who can't, go to the beach, can't play with their kids at the pool, they're just embarrassed, and not just even physical activity. They have to figure out what shirts to wear. A lot of guys end up wearing dark shirts or shirts that are patterned or striped, or they wear layers even when it's 85 degrees outside. These are the things that really start to impact their life on a daily basis, even to the point where they always end up sitting slouched forward because they don't want to sit straight up, and they start getting back pain and neck pain just from their posture. And I always tell guys, I said, look, if you can leave your house without thinking of your chest, I've done my job. For me, the day of the reveal, that when they come back at that 6-7 day after surgery and I take off all the dressings and just seeing their face, I've had guys literally start crying. That to me is everything. It's more important than anything, because it means I've made a difference in their life. And at that point, I'm on cloud 9. And
so Doc, tell us, what are the symptoms of gynecomastia? How does someone know that they have it and that they can actually be supported with surgery?
Yeah, so it's a great question. Purely symptoms-wise, sometimes there are no symptoms as far as sensation. In most guys, it doesn't hurt. They don't have any feeling that something is wrong, but they see something that's wrong. They see that their chest is bigger, it's grown bigger. But there are definitely guys where there's a lot of pain and very sensitive. Even giving them a hug would be a cause of pain. And so the symptoms kind of run the range, but I would say for most guys who come in to see me, they don't have very much in the way of symptoms as far as the way that it feels, but obviously in the way that it looks. That's a major symptom.
Now tell me about with someone that comes to you and has a surgery, is there a possibility that it comes back? Is this something they need to be concerned about, that this will actually, I don't want to say relapse, but will the body develop this breast tissue once again?
Right, so the body doesn't make breast tissue, once it's taken out, it's out, it doesn't come back. However, when I do the surgery, I don't necessarily take out all the breast tissue because it's unnecessary, and it's kind of a little bit dangerous to take out all of it because it can sink in. So I do leave a certain amount of tissue, and it's variable from one patient to the next. So if someone does something to maybe stimulate that existing breast tissue, for instance, start taking steroids or testosterone boosters, or do something that'll stimulate that tissue, then yeah, there's a chance that it can come back. However, there's a lot less breast tissue to be stimulated going forward. So the results of surgery are really as close to permanent as you can get in plastic surgery procedures.
I've been a surgeon for 10 years now in Los Angeles, and how many cumulatively total?
So I've been a doctor for 16 years and a plastic surgeon for 10 years now.
For 10, so you've seen quite a bit. Yeah. Doc, thank you so much for taking time out of your day and having an interview with us at PopWrapped. Tell us where we can find more information about you and people who might be interested in getting a consultation. Yeah,
well, Derek, it was my pleasure. If people want to find out more, I recommend them to go to my website, drdadvandplasticsurgery.com, or losangelesgynecomastia.org. It's got a lot of great useful information, a lot of before and after photos. And then most importantly, just come in for a consultation. I spend a lot of time with my patients in a consultation, answering a lot of questions, showing them before and after photos. So I think that's really the best way, seeing someone who's board certified in plastic surgery who specializes in this surgery. And I do over 150 of these a year. So I consider myself a specialist at this point.
Yeah, you better be. And you didn't even give the best part about how people can find you, is your hashtag.
Hashtag lose the man boobs.
Hashtag lose the man boobs.
There you go.
Doctor, thank you so much for taking time.
My pleasure.
Appreciate you.
Thank you.
That's it for right now. Thank you so much for tuning in. We'll check in with you guys real soon. Bye-bye.